3 months ago, Ontario pharmacists were given the power to prescribe medications for 13 common ailments to help take the load off emergency rooms and primary care. And now that list is about to expand.
We know that there are challenges with lack of family doctors. Many Ontarians don't have a family doctor, so this helps fill that void.
Pharmacists will soon have the power to assess more patients and prescribe a new list of treatments for things like moderate acne, canker sores, diaper rash, yeast infections, pinworms, and nausea and vomiting related to pregnancy.
The 6 additional ones, I think, will certainly help many Ontario families access these services in the community through a pharmacy. We've seen tremendous success so far.
Back in December, pharmacists were given the green light to prescribe the COVID-19 antiviral Paxlovid, and since then, the rate of dispensing the treatment increased by 130%. Then in January, those prescribing powers expanded to include pink eye, hay fever, acid reflux, UTIs, and other maladies.
I mean, is this taking pressure off the primary care system?
Well, that's 86,000 patient assessments that didn't go through primary care or didn't go through emergency departments or things like, clinics that are allowing for building capacity. You want the right people, at the right place, at the right time in the healthcare system. And I think it's that team-based approach that will increase accessibility.
Our province is behind many others when it comes to this. Saskatchewan pharmacists, for example, have been prescribing treatments for more than 30 minor ailments for years now. And in Alberta, pharmacists can prescribe any medication that is not a narcotic. Kristen Watt runs a pharmacy here in Ontario and tells me expanding the role of pharmacists needs to go even further to help battle things like medicine shortages.
We've talked about antibiotic back orders to no end, but that is just the tip of the iceberg. We deal with medications on back order for diabetes. We deal with medications on back order for blood pressure all the time. And pharmacists are completely equipped and able to switch medications for their patients. It's just we're not allowed to do it in Ontario. We need to do this because that is what will reduce the burden on the healthcare system. The poor family physicians who are so incredibly overwhelmed, just going to get another fax when a medication goes on back order. Whereas I, the drug expert, could completely be able to manage that. It's within my scope of knowledge. We need it to enter our scope of practice, and we need it to happen very quickly.
The regulatory process is about to begin to allow pharmacists to prescribe medications for those 6 new ailments starting in the fall. A list of conditions that right now can be assessed at your local pharmacy is posted on our website, citynews.ca.